Stroke is a medical condition that occurs when blood flow to the brain is disrupted, either by a blockage in a blood vessel or by bleeding within the brain. This disruption of blood flow can cause brain cells to die, leading to a range of symptoms that may include weakness or numbness on one side of the body, difficulty speaking or understanding speech, sudden vision changes, dizziness, and severe headache. Stroke is a medical emergency and requires immediate treatment to minimize the damage to the brain and improve the chances of recovery. There are different types of strokes, including ischemic stroke, hemorrhagic stroke, and transient ischemic attack, TIA, which is also known as a mini-stroke. Risk factors for stroke include high blood pressure, smoking, diabetes, high cholesterol, and a family history of stroke or heart disease. The symptoms of stroke can vary depending on the location and severity of the brain injury, but there are some common signs to look out for. The most common symptoms of stroke can be remembered using the acronym FAST. 1. Face drooping. One side of the face may droop or become numb, making it difficult to smile or speak clearly. 2. Arm weakness. One arm may become weak or numb and may drift downward when raised. 3. Speech difficulty. Speech may become slurred or difficult to understand, and the person may have trouble finding the right words to say. 4. Time to call for help. If you or someone you know is experiencing any of these symptoms, it's important to call for emergency medical help immediately. Other symptoms of stroke may include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion or trouble, understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause. It's important to remember that not all symptoms of stroke may be present, and some symptoms may be mild or temporary. However, any sudden onset of neurological symptoms should be taken seriously and evaluated by a medical professional as soon as possible. Early recognition and treatment of stroke can improve outcomes and reduce the risk of complications. There are several precautions that can be taken to reduce the risk of stroke. 1. Control blood pressure. High blood pressure is a major risk factor for stroke, so it's important to monitor blood pressure regularly and take steps to manage it, such as through lifestyle changes or medication. 2. Quit smoking. Smoking is a major risk factor for stroke, so quitting smoking or avoiding exposure to secondhand smoke can help reduce the risk. 3. Manage diabetes. People with diabetes are at higher risk for stroke, so managing blood sugar levels through diet, exercise, and medication can help reduce the risk. 4. Control cholesterol. High cholesterol levels can increase the risk of stroke, so it's important to monitor cholesterol levels and take steps to manage it through diet and medication. 5. Exercise regularly. Regular physical activity can help reduce the risk of stroke, as well as other health problems. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 6. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, lean protein, and low in saturated and trans fats can help reduce the risk of stroke. 7. Limit alcohol consumption. Excessive alcohol consumption can increase the risk of stroke, so it's important to limit alcohol intake to moderate levels. 8. Treat atrial fibrillation. Atrial fibrillation is a heart rhythm disorder that can increase the risk of stroke, so it's important to seek treatment if diagnosed. 9. Manage other medical conditions. Other medical conditions such as carotid artery disease, sickle cell anemia, and heart disease can also increase the risk of stroke, so managing these conditions through medication and lifestyle changes can help reduce the risk. Taking these precautions can help reduce the risk of stroke and improve overall health. It's important to discuss any concerns or questions with a healthcare professional.